Hi, Dr. Goss. My patient for my OSP for the final is a patient I saw in clinic. He's a 52-year-old Hispanic male who came into the clinic with a red rash to his right calf for 3 days. He was concerned that day because the skin there where the rash was red. It was hot to the touch, and he started to feel that he possibly had a fever that morning. And also, he is diabetic. His fasting blood sugar was elevated for the last couple days at 152, and he says it's always under 100. So those are the reasons why he came into clinic. And I'm going to go ahead and proceed with my physical exam and my assessment and plan for the patient. Hello, sir. Good morning. I'm Veronica. I'm a nurse practitioner student. I'm going to be seeing you today, and it's possible that the doctor also is going to come and talk to you after I see you. Okay.
Okay.
What's the reason for your visit this morning?
I've had a rash on my leg, on my calf, and it feels a little warm, but I'm a diabetic, and it's just that's why I decided to come in. Usually in the morning my sugars, it's been about 150, about there, but I've had like a fever. This morning I thought I had some chills. I thought I had a fever. I didn't take my fever, or temperature, but that's why I'm here.
Okay. What are your sugars usually under 100 in the morning?
No, they're about 150.
Okay, in the last couple of days, okay. So we always want them under 100. So sometimes, if something's going on or you have an infection, they may elevate your blood sugar a little bit. And you are taking your medicine, your metformin twice a day. You're taking that, and you're taking your simvastatin for your high cholesterol as well.
Yes.
Okay. And I looked at your last visit. It's been about 6 months. You were scheduled to come back a couple months ago for just your blood work to be rechecked and fasting blood sugar and all that.
Mm-hmm.
It's important to come in.
It's with work. It's just it's really good. I was just barely able to come in today. So.
Okay, all right. We just want to review the importance of coming in, but I do notice you never run out of your medicine, so that's good. Okay, I'm going to wash my hands and I'm going to come back and examine you. Okay.
All right.
Just move up a little bit here for me. Okay, and so no cold or cough or anything recently?
No.
Okay, no pain anywhere here, huh?
Nope.
Okay. And listen to your... Every time I touch you, take a deep breath. Okay, and just breathe normal and listen to your heart. Okay, very good. Is there any numbness? Go ahead and take off your shoes for me. And we'll look at both legs to compare them. Just lift up, that's fine. Your feet are not numb. There is a little bit of swelling on the leg you're complaining about, but your feet don't feel any numbness. Okay, all right. And it is a little warm compared to the other one. Your pulses here on your foot. Okay. They're present, equal. I'm going to use this little thin thread on the bottom just to check, just to make sure you have sensation, okay? So every time I touch you, let me know if you do feel it. It's going to be at the bottom of your toe and then at the tip.
Okay, yeah, I feel it.
Feel that?
Yeah.
This?
Yeah. Yep.
Okay.
Mm-hmm.
Okay.
Yep. Yes.
Okay, perfect. I'll check your other one since you're here.
Yeah. Yeah. Mm-hmm. Yep. Yeah. Okay.
Okay, perfect. It's just a little monofilament, and we just use that just to make sure that you have sensation. No vomiting.
No.
Okay, and you didn't take your temperature, just had chills.
Right.
Let's see. I'm going to, what it appears you have is an infection on your skin, and it's called cellulitis. It can become worse. So because of your diabetes and because your sugar has been a little elevated, we're going to start you on an antibiotic, okay? You're not allergic to anything I see on your chart there? Okay. It'll be twice a day. It's amoxicillin, and you're going to take it for 10 days. And are you having a lot of pain? It says 2 out of 10 that they wrote here. It's not really a lot.
2, 3, right around there.
Okay.
Between.
And you haven't missed work. You've been able to go to work and perform your work duties. Okay, good. If you feel in the next couple of days that you don't, that you can't tolerate being at work, you can always call the office and we can generate a note for you for work. Okay.
All right.
So it's important to start the medicine and complete it. What I want to know is, can you come tomorrow before you start work to get blood drawn?
Yeah.
Okay,
right.
Perfect. We'll draw blood, check some of the routine things that you're due for, as well as other, we'll do a blood culture and other extra tests because of this particular infection that you're having, that you're going through today, okay? I want to see you in 4 days, and I say 4, that way we have a preliminary report on especially the blood culture that I'm ordering for you, and then we can review all your labs, see how you're doing. If at any point the swelling gets worse, you have skin that's broken down because of the swelling, draining, consistent fever, increased pain, what are the things, numbness to your feet. If you can't tolerate taking your medicine because you're feeling really bad and maybe you're throwing up or not eating, or your sugar readings are extremely high, then please call the clinic so that we can either see you or kind of telephone you to seek emergency care if we feel that you need that at that time. But the important thing is, if it's getting worse, please call before the 4 days. Even if you just have a simple question, because we don't want you to have any kind of serious complications from something like this. And also check your blood sugar in the evening as well after you eat. Mm-hmm. That way, if it's, sometimes, and I know people don't want to ever add medicine or especially insulin. I know that's a scary thing. But sometimes when you're going through an infection, your body is going to have higher blood sugar readings. It's just a reaction that your body's having to fight the infection. And sometimes temporarily only, you may need that. And it'll help heal. It'll help you get through the illness quicker as well. Okay, it'll be a better situation to have your sugar normalized while you're going through the infection. So I just wanted to mention that to you, okay? And we'll schedule you for your physical. And what else am I missing here? I think that's it. Do you have any questions for me?
Do I have to come here, or can I just go to the ER?
You can always call us. It's always, we always try to keep you out of there. So if, and if we can better help you here in the clinic, it'll be more efficient. We can call in additional medicines instead of having you wait there for a long time. Sometimes the ERs can get very busy. So call us first, and then we'll give you guidance, especially if you're feeling worse. Okay, sir?
All right.
All right. Nice meeting you. Okay? We'll see you in about 4 days.
Great.